Good morning. I would like to thank the organizer to allow me to present our data. I don't have any conflict. So you already heard that tuberculosis caused by Mycobacterium tuberculosis is the leading cause of death by infectious diseases. And there is also latent TB. Around 2 billion people probably have those. So it's clear from last two presentations that we really need new drugs which would effectively treat TB, shorten the treatment, and hopefully also allow us to develop long-acting formulations. I hope that I will persuade you that one of the potential drugs could be the Telacebec or Q203. It's the novel drug from for new drug family, and it targets ATP production in mycobacteria. With the Mycobacterium tuberculosis, it has very low MIC, between 3 to 8 nanograms per ml, depending on the strain. And currently, the oral regimen is in phase 2 clinical study for TB, led by TB Alliance. What is also interesting about that drug, it was discovered that it's very efficient in inhibiting the infectious, some of the infection with non-tuberculosis mycobacteria. And one of the example is Mycobacterium ulcerans. This bacterium causes buruli ulcers, which is very serious skin disease. Because ulcer by toxin produce that specific mycobacterium. You can see that most cases are in the tropics and subtropical region in Australia and Africa. Sometimes it's called the meat eater, which kind of suggests how serious the ulcers are. Current treatment contain the multi-drug therapies. However, what was found that Telacebec has extremely low MIC in the picograms area, 72 to 150 picograms per ml. And first in animal models, it was shown that actually you need only the Telacebec to treat the ulcers. So currently there is oral Telacebec in phase 2 clinical trials as a single therapy to the Mycobacterium ulcerans. And the second non-TB Mycobacterium is Mycobacterium Leprae, one of the agents causing leprosis. Again, this looks like ancient disease, but we still have 200,000 cases per year. And again, currently there is a multi-drug therapy available. However, depending on the number of bacteria present, it could take up to 12 months. And again, it was shown so far on animal models that Telacebec as a single drug therapy can be very effective, at least to the same level as the multi-drug therapies. So telling you all that, we and the group in Denmark start to develop the long-acting formulations, not only for TB, but also for some of those regimens for the non-TB bacteria because the high effectiveness of the drug. So what I'm going to show you today are two formulations. They were developed independently. We have data from rats, the first data. Again, those two studies in a rat were done independently, so I will present them like that. So first technology which was used and that was doing by my group is based on in situ forming implants technology. And this is the technology which we are working now quite a time. Next abstract will describe the rifabutin, was also developed with the same technology. The long-acting formulation ISFI is injectable. It has the optimized drug solution in biocompatible solvent, and it also contains a biodegradable polymer. After subcutaneous injection, it solidifies in the implant, and drug is released directed by the degradation of the polymer. So for this particular experiment, we developed the ISFI formulation with concentration of the drug 105 milligram per ml. It was injectable with 25 gauge needle. We can sterilize it by filtration. And when we tested, it's fully degradable So you don't need to remove the drug in the end. So the second technology was developed in the South Denmark University, and they are using the microsuspension, which they prepare by milling approach with the zirconium beads. For the experiment, they prepare two concentration, 40 and 70 milligrams per ml. And you can see the particle size was 3.2 and 4.17 microns, respectively. So experimental design, as I told you, we tried to be very similar, but it was run independently. In our case, we have 3 groups of rats. One was just a small number for the placebo, and we decided for 2 doses for ISFI. The doses were those by different volumes, so we have one concentration 105 milligrams per ml, but the doses were 15.8 and 47.4 milligram per animal, or 75.6 or 220 milligrams per kilograms. The Denmark group actually prepared the formulation in the concentrations they were going to use, so they have same volume injected for all animals. And the final dose was 41 and 71 milligram per kilogram. So for the results with ISFI, you can see here, we actually have an experiment for 3 months, despite the target for us was to develop formulation at least for 1 month. So what you can see is that both doses were able to carry over the 3 months and were well above the MIC TB. That's the only thing what we have right now available based on the talk we just hear. But when you look at the MIC for Mycobacterium ulcerans, it's extremely several logs below. So it's very promising, especially from those non-TB bacteria. So the next slide, you see the same things, but now with intramuscular injection of microsuspension. And the difference between doses was not so great. We actually see the log scale, but there were the difference in the end, so you can see the AUC. And again, after the 3 months, 12 weeks, all of the concentration were above MIC for TB and extremely well above for Mycobacterium ulcerans. So in summary, we were able to develop 2 long-acting formulations with 2 technology. Both are able in a rats keep 12 weeks above the MIC of the disease I mentioned. And we are hoping for next development for those formulations. Last but not least, I'm showing here all the party involved. So we have for the microsuspension, those are people from University of Southern Denmark. From my group, you can see with UNC. Of course, the drug is developed by TB Alliance for oral, so they were their partner with us, and NIH and Southern Research, where the rat study was done, is also mentioned. Thank you.